Leicestershire Partnership NHS Trust has recently spent £500,000 refurbishing offices so they can be used for much needed treatment rooms for youngsters with mental health issues. It has happened at Westcotes Lodge near Leicester's Narborough Road, a Grade 2 listed building.
Hi, I'm Steph Buswell. I'm the Family Service Manager of the Child and Adolescent Mental Health Services. I want to introduce you to the new building we have and take you round and just show you the facilities. Welcome to one of our bigger rooms. This is going to be used for family therapy and neurodevelopmental assessments. So Westcotes Lodge has become a clinical space more recently for CAM services. It was an unutilised building for quite a significant period of time, and LPT were able to absorb it into their portfolio, which is great. For me, more importantly, it's been absorbed into CAM's services, so that it offers us much more clinical space really to see young people on our caseload, but also young people waiting to access the CAM services.
And what does CAMS do?
So CAM stands for Child and Adolescent Mental Health Services. It's there to support young people with mental health difficulties that are impacting on their day-to-day functioning. As you can imagine, since COVID, the increase into CAMS, particularly from last year, so 2022 to 23, we had an increase of 67% of our referrals into a CAM service, which then has an impact on waiting times, service delivery, etc. So for us to have more space to be able to see young people is going to be absolutely fabulous. For us, we've worked very hard at designing this building to ensure that the rooms young people and families come into are safe, welcoming and not intimidating. We know that coming to services to talk about challenging issues and some of the experiences they had can be really uncomfortable, and if we can make the environment as comfortable as we can, that's what we've tried to do here. For this building we now have an extra 7 clinical rooms that are now available to CAM's clinicians. So on a daily basis it's probably an average of 42 extra face-to-face appointment slots that we can offer. Per week that's going to be an average of 210. We do outside of hours as well, so that could increase it even more, but that's a bottom baseline of appointments that we're going to be able to offer. We know during the pandemic we were able to access sort of telephone support, we were able to offer video support, but what we are finding more and more, particularly with young people, and families, they want to be seen face to face. We've recently had, for us, we've been really recruiting. We're aware that that our waiting lists have been increasing with the demand of the service. So we've done lots of recruitment recently and successfully recruited quite a significant amount of new clinicians. So again, that just will offer. This space will be able to offer those more appointments that are so needed for young people when they're these challenging and struggling. This is one of our therapy rooms. It's going to be used either for seeing young people one-to-one or with families. We've tried to make the environment as clean line as possible. We're aware of people struggle with the challenges they have and talking about their challenges, so we particularly looked at getting furniture that would make you feel comfortable, and looked at furniture for sensory difficulties as well. I just think it's been lovely to see the development of this. I have to say, I wasn't right at the beginning, but I've seen it develop over the last 6 months, and just to have a space where young people can come that is calm, it feels relaxing in here. It's a space that isn't overwhelming for young people. We've tried to make it as accessible as we can. We're aware that people have sensory challenges, they're things that, so we haven't made it bright and colourful. We've made it a sort of smooth, very smooth, calm place for young people and their families to come. So it's been fabulous to to see it develop, but also know that we've got it now, that we can start to utilise it as soon as possible, really. Which we do have lots of other bases that we do utilise, but we are aware that particularly in this area we get lots of referrals. What we try to do significantly within CAMS is see people in their local areas. We know that not everybody can travel, it's costly to travel. We know that actually getting here from, if you're in school, some people have to have an hour travelling, then a session, then back. So what we are trying to do is just make sure that the spaces we have are accessible to young people in the areas that they live.